For those of you that don't know me, my name is Diane Bier. I am a caregiver to my husband David, who also cares for me. We have a whole thing on that. And I also run marathons, half marathons, and I am very active in the brain tumor community. What I'd like to do is start by taking a look at this first slide. If you look at this first slide, you'll see that there's faces on there. And brain tumors do not distinguish between ethnic, socioeconomic backgrounds or anything like that. They don't care if you're an adult or a child. So that's one thing that I did want to point out. The other thing is that, just lost my train of thought. Oh, okay. So just by looking at someone, you can't always tell that they have a brain tumor. They just look like a normal person. And you're going to experience some of that. People will just say, oh, gee, you look normal. You don't have anything wrong with you. What are you doing parking in handicap? Well, I have a brain tumor. I have seizures. So some of those things, you may or may not experience. The other thing that is, because I do a lot of running, the Tug McGraw coach, Kevin Leathers, wrote a poem. And there's some things in there that I think are really applicable to any type of cancer that you're fighting. So he wrote a poem that's called Life is a Marathon, and I'm going to read to you pieces of it. And it starts out with, it takes patience, devotion, focus, and toughness. And you need to learn to worry about what you can control, not what you can't. And enjoy the good days because they don't always last, and persevere through the rough times because they don't last either. And planning pays off. Long-term goals are achieved through short-term goals. So you want to trust in yourself, and you want to believe. And the other thing is that your family and your friends will revel in your successes. Excuse me. Out front at the desk, there is a Cancer 101 package. There is one for every family. So what I'd like to do is, I did go through it, and there is a lot of valuable information in here. But the one thing that I do want to stress is that in this book, there's various sections in there, and we're going to go through the sections, but it's really important because it talks about the type of cancer that you may have. There's a section for notes, because one of the things that I'm going to emphasize is keeping a diary. There's a thing on there about a one-year calendar planning, things that you'd like to do. So make sure that you get one of these packages. So these are some of the things that we're going to talk about. We're going to talk about why did this happen to me. We're going to talk about the different resources that are available to you, what you can do about your diagnoses, the standard of care versus clinical trials, the side effects, quality of life, because that's a big issue, how to cope, and a couple of things at the end which I think are really important, asking for what you need, thriving, and celebrating life. And if you have any questions as we go through, please just stop me. I don't have time for brain tumors. I have too much to do. And what fun is life if you cannot laugh? David says these sayings all the time. And one of the things that I want to point out with this is that it's really important to have a sense of humor, because your sense of humor will really help you through some of the rough times. When you're first diagnosed, there are certain things that just hit you. Why me? Why did this have to happen to me? I'm not a bad person. Why didn't it happen to Osama bin Laden or some of these other people that are, not good people? And these are just all normal things that we all feel. You can be mad or angry with God if you're a religious person. You want to take some action and you want to be able to move ahead. So some of the negative feelings that you may have, you want to be able to talk about them. I can remember when David was first diagnosed, I was in the hospital room. I felt like someone slapped me across the face. Just really, really just slapped me across the face. And it was like, oh my God. So some of these things that we all feel are normal. These are just some resources that I've pulled together. If you want to make a check mark, there's some that are really good. There's NIH, which is right here. All right. So you have NIH, the Musella Foundation, which is the second one down. They list the clinical trials throughout the United States and the world. The one thing that you're going to find with clinical trials that they're doing. They will not have the clinical trials that the Cleveland Clinic or that Cedars-Sinai or UCLA or Duke or MD Anderson, they will not have the clinical trials that are happening elsewhere. So you need to be able to have access to that information. And one of those places is virtualtrials.com. Okay, so if the Brain Tumor Center or the hospital that you're being treated at does not have the clinical trial that you want, look elsewhere. There's other resources on there. There's Social Security. For those of you that are not aware of this, if you have an anaplastic astrocytoma or a GBM, there is compassionate allowance, and you, I'll use the word should because some people do have issues. And Angel Food Ministries, those three particular resources. Caring Bridge is a website that you can go out and you can put your information on for your family, and it's a way of updating all of your friends and relatives without having to send out 25 million emails. Lots of helping hands and Angel Food Ministries. The Angel Food Ministries will help families with food, and Lots of Helping Hands is a scheduling online scheduling, so if you need something done, you can put it out there and people will sign up to do things, help you, with whatever it is that you're asking them for. And the last one that's on there, I want to spend a minute talking about the Randy Pausch video. For those of you that don't know, Randy Pausch was diagnosed several years ago with pancreatic cancer. And the diagnosis was very grim, and he was a professor at Carnegie Mellon. If you have 10 minutes, listen to that video. It's called The Last Lecture. If you have an hour, listen to the full video. It is incredible. But if you only have 10 minutes, the shortened version is excellent. It is just as good. Any questions so far? Okay, what to do, what can I do? One of the most important things, and I can't stress this enough, is to A, stay positive, and I know sometimes it's really hard, and B, become your own advocate. No one is going to tell the doctors what you're feeling or what it is that you need except for you. And if you don't like the answer that you're getting, or you don't like the care that you're getting, find someplace else to go.
When you say care, you mean from your spouse or your doctor?
Can you answer that, please?
I am definitely my own advocate.
Actually, it would be, if you're really unhappily married, I would say find somebody else. But I know with you and Henry, that's not the case. But if you're not happy with your doctor or your team of experts that are helping you, then I would absolutely find someplace else to go. You have to learn to be your own advocate.
We've
And-
switched many times.
Yeah.
As have I.
And you really need to push for what's important for you. And everyone is different, and every brain tumor diagnosis is different. And every person has a different view of what it is that they want to do. Some people will say, I'm going to fight this, and they go through surgery, radiation, chemo, and they do it over and over and over and over again. And that's their choice. And their friends and family and spouses should support that. That's their choice. And then there's other people who have gone through surgery, radiation, and chemo once, and they say, I've done it once, I'm never doing it again, and I don't care if this thing comes back in, 1 month or 100 years. I am not doing that again. And that's their choice. And same token, as hard as it is, their family and friends and spouses should support that. So not only the patient, but the caregiver also needs to become that patient's advocate for whatever it is that they would like to do, whatever course of action they want to follow. You need to build a medical team. So you need to have, obviously, if you're going to have the tumor removed surgically, you're going to have a surgeon. You will have a neurologist. And if you have a grade 3 or grade 4 brain tumor, then you would have a neuro-oncologist as well. You're going to have a nursing team to support you. And then in addition to that, I would also say to build your own support team outside of the medical community. So with your friends, your family, your church or temple, if you participate there, find a live brain tumor support group in addition to the online groups. The online groups, you can, hop on the computer and get your information instantaneously. But there is something to be said for actually meeting other people that are going through something similar to what you are in person.
How would you encourage someone who says, I don't want to be with those people. I don't want to be with sick people.
This is what I tell people about our support group. Our support group is different, and people don't sit around and cry, oh, this happened to me, why me, what about this, what about that? They are proactive in trying to help people get through whatever they're going through. And we've had people come to the meetings and they sit there and they will cry the entire meeting. And that's okay. And then there's other people that come in and they're just really quiet and don't talk. And then there's other people that come in and talk up a storm. So they're all different. Flo, I know you were going to say something.
You said talk up a storm. People who are quiet, that's not me.
No, that's not you. That's definitely not you.
But I want to say, when you went back and said it's a patient's decision, when I was first diagnosed, I was out in Long Island. Stupid, stupid doctor. He even said to me, don't get treated here. So he sent me to NYU.
Well, he was smart in that respect.
So he sent me to NYU for my biopsy.
Mm-hmm.
And then I went to Sloan because the doctors at NYU said that they have more updated equipment because mine is inoperable. So was assigned a neurologist. I loved her. My father did not. He was my transportation. I lived with my parents because Henry was driving all the time, and Henry's mom came in and was taking care of Nicole. And he kept saying, I don't know why you like this woman. I think you should find somebody else. I said, I like her, Dad. So I stuck with her. If I went somewhere else, who knows if I'd still be here.
Yeah, but it's your choice.
Right.
It's your choice. The other thing that I think is really important is that you find out the tumor type that you have and that you do research on it so that you know the trials or the standard of care for that particular tumor, because each tumor is different.
Skipping over statistics.
I'll talk about statistics, but not in the same way that everybody else does.
When you do the research,
Yes.
skip over the statistics.
Yeah, I'm actually going to spend a few minutes talking about statistics because they're a number. When you're diagnosed, the first thing that you really should try, first and foremost, is the standard of care. And the reason for that is because the standard of care is what works for most people. And there are a few exceptions to that, and I'll get into those in just a second. So chemotherapy, surgery, radiation is the standard of care. The other thing that you really want to consider is second opinions. So if you're going to go for second opinions, go to a major brain tumor center. You can go to Cleveland Clinic, you can go to Duke, Cedars-Sinai, UCLA, MD Anderson. You know, there's lots of brain tumor centers that you can go to. NIH is one for a second opinion. The other thing that's really important is that whatever decision you make, don't look back. Because the decision that you make with the information that you have then and there. And the information that you have 3, 6, 9, 12 months down the road is going to be very different than what you have today. So whatever decision you make today, go forward with it. And don't look back and say, what if, I should have, nothing. Just put that out of your mind. It's really, really important to do that. When you have a brain tumor, if you do not have the brain tumor surgically removed, most people will do a biopsy. So between either having a biopsy done or having surgery, you will get a pathology for your tumor type. And it's really, really important to know what the pathology is of your tumor, because it will tell you the type of tumor that you have, and it will tell you the grade of the tumor. Depending upon the grade of the tumor depends on how it's treated. So tumors are graded 1 through 4, 4 being the highest. So if your pathology comes back that you have a mixed tumor, grade 2, grade 3, you always treat for the highest grade.
Okay, explain, Lucy.
Okay. So a grade 1 is low, and a grade 4 is high. So if your tumor is a 2, 3, you want to treat for a 3, because that has, those tumor cells are cancerous, whereas the grade 2 at that point are considered, I'll use the word benign, but I'm going to use it loosely. Okay. Of all your medical records. And I know that, you know, you're already sitting there saying, I got a stack like this. And if you talk to Flo, who's a 17-year survivor, right? She's got a room this full of medical records. Keep your medical records, every single one of them. Your MRIs, nowadays they're really nice because they come on CDs, but I know that when Flo and David started this journey, they came on film. So originally David had this huge artist portfolio that he used to carry around with all his MRIs, and the thing must have weighed 1,000 pounds, literally. So keep all of your medical records. Keep a copy of the radiation reports, the type of radiation you've had, and how much. Because the old school thinking was that once you had radiation, you could never have it again, that there was a maximum dosage. That's not true anymore. So if you have radiation, you need to know what type of radiation and how much. Because let's say your tumor comes back or reoccurs 5, 10, 20 years down the road, you can go back and say, I had this 20 years ago, and then they're going to say, okay, it's been a long time, we're going to do this, this, and this. So it's really important to know how you have been treated in the past. So you want to keep a copy of all your MRIs, a copy of your pathology report, any chemotherapies that you've taken. So you want to keep a copy of that. You also want to make sure that you back up your MRIs. All right, so always make sure that you have copies of the older MRIs. Any questions so far? Excuse me, just a minute. No, don't worry about it. We're informal.
Thank you.
You're welcome. So make sure you keep a journal of everything. Your seizure meds, chemo, radiation, anything that if you've been in a clinical trial or you've done anything experimental, how long, what, the whole 9 yards. Keep a journal.
What my doctor found very helpful was I had a journal of my seizures. I'd write down what day it was, what time of day.
Yep.
What I was doing prior to it, and how long it lasted.
Yep, I'm going to get into that in just a minute, so thank you. Okay, so doctor appointments. Doctor appointments can be long and tedious, and you can have tons and tons of waiting. David and I had an appointment right after his surgery with the neurosurgeon, and we waited 2 hours in the waiting room. So you can really get caught up on your People magazine and your Star magazines and all of that. So plan on waiting, bring a book, anything like that. In preparation to the doctor's appointment, make sure that you bring all of your records, your journal, copies, okay? Not the originals, because you need to make sure you keep copies of everything. So make sure you bring copies to the doctor. Any questions that you have, write them down ahead of time, okay? Because this way you can go in and you can be prepared for what it is that you want to talk about. Some people, if they can't bring a person or a friend or a spouse with them, will bring a tape recorder, because you can go back over what it is that he said. Because if you don't, or you don't write down the answers, once you walk out of that room, you can't go back, you know, an hour, 2 hours, or a day or two later and get that information. So bring a notebook with you, make sure your questions are written down, write down the answers if you need to. If you want, bring a tape recorder. Okay, all things to help you remember what it was that happened at that visit. If you have any scripts that you need filled, okay, seizure meds, chemo, anything like that, make sure you get that. And the other thing that's really, really important is whatever questions you have or whatever issues you need to be addressed, make sure that they are addressed to your satisfaction. Not the doctor's satisfaction, your satisfaction. So if you're not happy with the answer, ask again. And sometimes you don't have to like the answer, but if the answer is factual and it's information that you need for you, that's one thing. But if the doctor is not answering the question to your satisfaction, keep asking. Ask it a different way. If it's a question that's this long, break it down into little pieces and ask. And if you find that your doctor is not taking the time that you need with you and is not getting you the information that you need, and you don't feel that he is helping you, or she, then it's time to find a new doctor. And David will tell you, we've been down that route lots of times for lots of different reasons. Okay, so some of the reasons are you need to have a doctor that's geographically desirable. You know, if you live in New Jersey and you continue to see a doctor that's, you know, out in Kansas, getting to Kansas is an issue when you're having a seizure. They can't get you. Okay, so you know, you want to make sure that you have a local team of doctors in addition to if you're being seen at a brain tumor center that is not local to you.
Do you want to talk about the doctors
I can.
We went through that.
Yeah, we did. Unfortunately, we did.
Or the bedside manners.
Yeah, that goes into if they don't answer
Your question.
your questions. You know, and everybody has decisions to make. Not all doctors take all insurance, and not all doctors have great bedside manners. So you need to decide, A, if you really like the doctor and they are not in your insurance, do you want to see them? That's a decision because you're going to have additional out-of-pocket expenses. The other thing is that you could be seeing a doctor that's really good that just has a lousy bedside manner. And you have to make a choice. What's more important to you? Someone that is really good at what they're doing with their job, and they don't talk to you in either a nice tone of voice or bring it down to your level or whatever. Because let's face it, we're not all doctors. And this diagnosis was just dumped on us, and we're trying to get up to speed. And this person over here has been doing it for 100 years, and you know, they're using words up here, we're down here, and some people just can't bridge it. So you have to make a decision, you know, what's important. And yeah, a nice medium is always great, but you can't always find the medium. And sometimes, unfortunately, when you get a diagnosis of a brain tumor, you're thrown into a crisis mode because most of the time it's surgery. Oh, you have a brain tumor. You're scheduled for surgery tomorrow. And you don't always have the luxury of doing some research and finding out, well, gee, there's this vaccine trial. Because a lot of the vaccine trials only take newly diagnosed, no radiation, no chemo, no surgery. So how does that patient who's just newly diagnosed find out about that? They find out about it after the surgery when it's too late, because most of the vaccine trials at that point won't take frozen tissue. So it's really important to ask up front what is being done in this field. What options do I have besides surgery tomorrow? Can I wait 2 or 3 days and go out on the internet and do some research? Any questions so far? Okay. Bless you. Earlier I talked about keeping a journal. This is a sample. You can keep a journal either using a spreadsheet like this. You can set a spreadsheet up in Excel if you'd like. Flo pointed out earlier that with her seizures, she used to write down when she had the seizure, how long it lasted, you know, what time of day, what she was doing, when it occurred. All of those things are really important if you have seizures. Okay? Because there's lots and lots of different seizure meds, and everybody reacts differently to them. So it's important to write down what has worked and what doesn't. You may also want to do this if you are on chemotherapy, because the anti-nausea drugs for chemo are different for everybody. What works great on one person doesn't necessarily work well on another person. When David was on chemo, and I keep using David because that's my experience, when David was on chemo, the first anti-nausea drug that they gave him did not work. It was horrible. So he spent the first week of Temodar miserable. So we went back to the doctor and said, this anti-nausea drug isn't working. So they gave him something else. And the schedule that he was on was he would be up at 6 o'clock, take the anti-nausea, or 7, I forget which, and then he would take the Temodar like 2 hours later. And then if he got nauseous at any time during the day, Compazine is a wonderful drug. So what works for one person doesn't always work for another. So you want to write down not only seizure drugs, but any other drugs that you're taking that may affect the treatment plan that you're on. That includes homeopathic remedies. we did talk about standard of care. So you want to do what works for most patients, and that's surgery, radiation, and chemo. Was everyone in the conference room for the keynote speaker when Dr. Vogelbaum talked about Gliadel wafers? Gliadel wafers are, when they're doing surgery, it's a chemotherapy that the little wafers that they actually place into the cavity where the tumor was. And Avastin has been approved FDA for GBMs, which is a grade 4 astrocytoma. GBM grade 4, it's the same thing, just two different words for it. So you can use Avastin. I do want to caution people on using Avastin. Works very well for lots of people, but if you use it, it will eliminate you from a lot of the clinical trials that are available. Go ahead.
I didn't really understood that before. Because they were saying chemo for the newly diagnosed GBM and then Avastin for after. So I thought you were using chemo at first, and then if it was to come back, you couldn't use any more chemo, and you would use Avastin.
Avastin.
Tumor, for example, and you would have to use Avastin.
Avastin, okay. The standard of care is surgery, radiation, and Temodar is the standard chemo. If Temodar fails, then they look at other chemos with or without Avastin. Okay. A couple things that, if you want to talk about Avastin, see me after, and I'll be happy to talk about it a little bit. There's some things I think that that people should know about with Avastin before they start using it. It can be a great drug. It works well for some people and not so well for others. And there are lots of types of chemotherapy. Not just Temodar, there's BCNU and so on. Carboplatin is another one. And then the Gliadel wafer is the chemo that gets put in when they're doing surgery.
Can I ask a question?
Yeah, absolutely.
For the Gliadels, can you go, like, let's say you actually don't need to get any tumor removed,
Mm-hmm.
because it's surgical, can they go in at any time and place that in, or it has to be like while you're removing a part of the tumor?
They usually do it while they are removing the tumor.
And I wonder, well, I guess the doctor say if your tumor was inoperable.
Then Gliadel is out. Unless there's a way to insert it, but I'm not aware of those.
Yeah, I was inoperable.
Yeah. Okay, clinical trials after standard of care. The exception to the standard of care is with the vaccine. So if you are newly diagnosed and you have not had any radiation or chemo or surgery, try to get into a vaccine trial. They are extremely successful. Okay. The other clinical trial that I want to talk about is Novacure. Is anyone familiar with that? They've heard Novacure TTF. Okay, it's a device that actually goes on your head, and so they'll shave parts of it, and you carry this device around, and it actually helps to kill the tumor cells. And it's used right now for GBMs. It's been used in Europe for quite some time on 3s and 4s, grade 3s and 4s. On side effects. Side effects from a brain tumor may or may not happen to you. They can happen to some patients and not others. We try to keep the stress as low as possible. Not that it always works, but we try.
I don't even know if my husband can have seizures or not. I don't know if it's something normal that should happen because he has a brain tumor, or if it's particular to a brain tumor.
He does not have to have seizures. Just because you have a brain tumor doesn't mean that you have seizures. Okay, so some people find out that they have a brain tumor because they've had a seizure. But not everybody has seizures in order to have a diagnosis of a brain tumor.
Okay, but does that, if he didn't have seizures yet, does that mean he won't have them? Or he can always have one?
He might maybe in the future, but there's no guarantee. And if he's not having seizures right now, then right now I would say to you, don't worry about it. You've got enough other stuff to worry about. You've got enough other stuff to worry about. It's hard enough, keeping journals and writing everything down and figuring out what meds he's going to take and not take. And if you have kids, that adds a whole nother level of complexity because you want to keep them on their, quote, normal everyday schedule and activities. And you still have to get to doctors and go for your MRIs and go for radiation and all these other things.
Because you are talking at the beginning about the handicap spot when you are parking. I didn't even know.
Mm-hmm.
I know maybe it seems weird, but I didn't even know my husband could park in a handicap.
You have to get it.
You have to get a placard.
Yes, but I didn't even know he could have that. Because for me, he is not.
Right.
I don't know if you see what I mean.
Yeah, I know. You don't need it, so you weren't aware of it.
Yes, he seems so normal.
He doesn't seem handicapped. is what you're saying.
Yes.
Yeah.
Right.
I have
So,
one.
I didn't even know I could have that.
I just talked to my doctor and said, "Do you think I can get one?" So she had to just fill out a form. And I sent it in.
You can get the form on the NJMVC website.
Mm-hmm.
You can just download the form from the New Jersey Motor Vehicle Commission, and I think it's a 2-3 page thing. The doctor fills out his portion.
Yeah, if he needs it, then get it. If he doesn't need it and feels fine without it and, doesn't have any issues walking or anything like that, then that's one thing. But if for some reason he, is having a hard time walking and can't get from point A to B or needs to go in a wheelchair or is having seizures or any of these other things, then absolutely go and get it.
Just touch, I think I may have missed something because the seizure thing is an issue with my sister. Don't drink, the citrus juice.
No citrus.
Right, is counteractive. Eat at the same time every day, reduce stress, rest, and I think I missed some.
No, I think that's it.
Okay.
Stay on a regular schedule. I know it sounds kind of crazy, but it's kind of like the analogy I can make is when you have a baby and you get them on a schedule, you want to do the same thing for someone that has a brain tumor, particularly if they have seizures. Keep them on the same schedule all the time. So
That's another stress though, trying to keep the schedule.
well, no, I mean, if you normally eat at 6 o'clock and it's 6:15, it's no big deal. But if you normally eat at 6 o'clock and you're going out to dinner and it's 8 o'clock, have something at 6, a snack or something like that to carry you the extra 2 hours. If for some reason they're really tired and you're supposed to go out later that day, take a nap during the day or reschedule the event.
Mm-hmm.
And your family and friends will understand. Quality of life. And I think this is really important for all of us. It's really important that you take time to relax, that you have some downtime, even if it's only 15 or 20 minutes a day. And when I say this, I'm talking caregiver and patient. So even if it's 15 minutes a day and you just sit outside on the deck and have a cup of tea or a cup of coffee because that's what you enjoy doing, that's fine. Do something that you love to do. Whether it's go for a walk, have a cup of tea, read a book, go for a run, whatever it is, take 15 or 20 minutes every day and make sure you get some downtime. You're going to laugh at the next two because I know that we've already talked about those, to make sure that you get enough sleep and that you have a daily routine. Okay, so those are really important. Make sure that you get enough sleep, that you eat nutritional foods, nutritionally dense foods, and don't skip meals. All right, and there have been some different views on nutrition. Some people feel that if they have cancer of any kind, that they're going to eat only nutritionally dense foods, that they're going to eliminate all sugar from their diets, and and so on. And if that's what they want to do, that's fine. And then there's other people that feel, you know what, I don't care. I eat good enough most of the time, but if I want to have that McDonald's or I want to have that brownie, I'm going to have it. And there's nothing wrong with that either. It's a matter of a personal choice. Why are you laughing? The brownies? Yeah.
Well, she puts it on the table and we have a choice to like take it or leave it.
No, I eat it.
Oh.
No, he loves brownies.
No,
And I eat at McDonald's. I don't care.
So it's a matter, it's a personal choice.
Yeah, deprivation of a desire is not going to do well for you over a long period of time.
Yeah, and some people, they just feel that they want to, do the Jeannie Wallace nutrition, and that's fine. If that's what you want to do, that's fine. And if you feel that that's what's going to help you, then do it. And if you just say, I eat 3 meals a day, I eat, fruits, vegetables, protein, and most of the time it's pretty good, and I want to have that McDonald's, or I want to have that cake, or whatever, ice cream, whatever it is, that's fine too. It's your choice.
Do you recommend a nutrient drink like Ensure or something else?
If they're not eating, absolutely. Yep, because they're nutritionally dense.
Jean Wallace, is that all supplements? You mentioned her name.
She has a whole nutritional program, and it's eat this kind of foods, eat that kind of foods, and I believe she also has supplements, but everybody's different.
Is she the one that her partner had cancer and was
Yes.
cured or something from
Following her nutritional guidelines.
Okay.
Thank you, because I didn't know that she had a partner with that.
Yeah.
So
She's out in Utah.
she's in Utah or Colorado.
Because you can go online and order her
Mm-hmm.
things. Okay.
I remember one time she was a speaker at our support group,
Oh, okay.
and this other gentleman who was diagnosed with the same brain tumor I have, we were drinking coffee, and we always have food, little light snacks, and she says, sugar is the worst thing for brain tumor
I
patients.
heard that. I read that.
So I looked at this guy, and I was like, let's get a donut, take your coffee, and go in a freaking hallway, and that's what we did. And my husband knows if I stopped sugar, I would die.
Forget the break.
Yeah, so everybody's different. I mean, and I'll leave it at that. The one thing that I think that's really important is that everyone gets up and does something. I'm not saying go run marathons, but when you sit there all day and just feel sorry for yourself, it's counteractive to your good spirits. So go and do something. If you don't feel well that day, or you feel really negatively, then go find someone to talk to. Whether it's your spouse, a friend, a pastor, a rabbi, doesn't matter. Find someone to talk to. If you really continually for a long time don't feel well, then they have all kinds of drugs that will help raise the serotonin. Get something. Get something and feel better so that you can go and do things. The other thing that's really important is that to get some exercise. I'm not saying go run marathons, but get out and do something. Do something that you enjoy, whether it's a walk, if you only like to lift weights, if you like to row or bike, Get out and do something. There have been lots of studies that show that cancer patients that are physically active fare much better, and the exercise will help reduce stress and help you sleep, which everyone knows everybody needs to sleep well and get a good night's rest in order to do well the next day.
But don't exercise at night, because when you exercise, your adrenaline gets high, and you can't get
Yeah, don't exercise at 10 o'clock at night. Coping, that first year, okay, or the first couple of months can be really rough. It's a new normal, and that new normal is going to change several times throughout that first year, because when you're first diagnosed, many people will have surgery. Some people may or may not have radiation, and some people may or may not have chemo. So every time you do one of those things, the new normal changes. So when you have surgery, the new normal then is you're in the hospital, you're running back and forth if you have kids, you're bringing kids in and out, you have family members and friends that you have to update on progress and status and what's going on. Then the patient comes home and they're going to rest for the next 4 to 6 weeks, because they never do radiation immediately after surgery. There's always a waiting period of 4 to 6 weeks. So that's the new normal for that time frame. Then radiation kicks in, and that's 4 to 6 weeks, depending on the type of radiation you have. If you have the standard radiation, it's every single day for 6 weeks. And they like you there at the same time every single day. So that becomes the new normal. So you work that into the schedule in addition to all the other activities that you normally do. When radiation finishes, I know, we'll go to eat in just a minute. I'm always running over, so if people want to go and eat, it's fine. So,
Sorry.
no problem. I'm not upset.
It's that time of the day, same thing.
So yeah, same time every day, and I'm not listening to myself. So when radiation ends, you're like, oh, gee, I have a couple more hours in the day, and then you end up with just the chemo. Some people may or may not have chemo at that point, and then your MRIs every 3 months or 2 months, depending on the schedule that you're at, and the doctor's appointments. And then after the first year, and you're continually evaluating where you're at that whole first year. Every time you walk into the doctor's, it's, what about this? What about that? Are there any changes? Are there this, that? So that normal changes throughout the year. The first year can also be really difficult. So and particularly at the beginning. So if you find that it's difficult, break it down into smaller pieces. Take it only the morning. I can get through breakfast. I can get the kids off to school. I can do the next couple of hours of whatever it is I need to do. Gee, it's lunchtime. I'm halfway through the day. Okay, so if you need to, break the day down into smaller pieces. Keep a list of who does what and when. So when David was first diagnosed and was in the hospital, I used to send out these email blasts. I need somebody to watch the kids these days from this time to this time. So I had people that would sign up. So I just kept a list of this one's coming this day, this one's coming this day, that one's coming that day, to help with, so that I could go to the hospital or the kids could get to whatever activities they were doing at the time, and so on.
And if you don't have that resource among friends, if you have a church or a synagogue or a group like that, you can always put it out there.
Put it out there. Okay? And then this is where you can use the calendar, lots of helping hands, all right, to put that out there. You can use email to help you for the things that you need. If you have children, the way you would talk to smaller children would be very different than the way you would talk to teenage or adult children. All right, because smaller children don't always understand or comprehend what a 25-year-old understands and comprehends. So you're going to talk to them very differently. If you're talking to small children, the one thing that you really want to remember is that they need to know that their parent or loved one, if it's an aunt or an uncle, is going to be okay, particularly the first few months. So it might help them if they ask to go to the hospital, take them to the hospital. Keep your visits short. 10 minutes and out. Because after 10 or 15 minutes, you're going to see that they're bouncing off the walls. And the last thing you need is for them running around. So, you know, take them in to see their parent or loved one or whoever it is, but keep the visits short. Find a live support group, okay, because they are definitely an advantage and different from an online support group. The other thing that's really important is find long-term survivors. I don't know if any of you have done any type of research on statistics for your particular type of brain tumor, but most of the statistics are pretty bad. They're not great. The one thing that you want to remember is that what's a statistic? It's a number. That's all it is. It's a number. It's no different than your age, your height, your weight. It's a number. And if somebody says you have 1 month to live, what are you going to say? I don't think so. Not acceptable. Not me. No. I've got other things to do. This is not acceptable. I'm going to go do other things. So find the people who are long-term survivors. I'll talk to you very briefly about several. One is Jenny McDevitt. She passed away last November, but she was a 7.5-year GBM survivor. Okay, she ran marathons on chemo. Not one, like 7 or 8, and tons of half marathons. So find people that are long-term survivors. David Bailey, another long-term GBM survivor. He unfortunately also recently passed away last October. 14 years. Okay, find those people. Do research. Research on the internet. You will absolutely find them. But there's lots of long-term survivors that are out there. Matthew Zachary is another one. Okay, when he was diagnosed, he was in college. I think he was like 20 years old. They gave him a year or something to live, and he was a concert pianist. And you know, he's I don't know how many years out now. Married, twins, is absolutely a concert pianist. Fought his way back. So there are long-term survivors. Okay, and you have several in this room. Flo, who I don't mean to pick on, but I'm going to pick on. Flo is a 17-year survivor. Okay.
And I'm supposed to be dead before 1995 ended.
Okay.
According to the neurosurgeon.
Okay. Go ahead, Caitlin. You can.
David.
Don't pick on me.
Okay. So find the people that are long-term survivors.
So how long have you been married?
11 years.
You're a long-term survivor.
There you go.
Thank you. I like that.
Yeah, I am.
He is too. This is really important. For those of you that have the few minutes that can watch the Randy Pausch video, he has a saying in there, ask for what you need. And I am a huge believer in asking for what you need. If you ask for what you need, you will always be given. And smarty pants. So if you're having a hard time coping and dealing with the diagnosis of a brain tumor, and it's not an easy diagnosis, and depending on the type of brain tumor that you are fighting or helping a loved one fight, it's not always an easy thing to deal with. And if you feel the need to go and find a counselor or a therapist to talk to, Go and do that. Okay? And if there's someone in your church or your rabbi or your minister doesn't cut it, find someone else. And I'll go back to saying the same thing that I said earlier. If you have a neuro-oncologist and they're not giving you what you need, they're not answering your questions, they're not helping you, find another one. If you choose to go to a counselor or a therapist and after several sessions you don't notice a difference or they're not helping you, then they're not the right person for you. Offload whatever it is that you can offload. So if someone offers to make you meals, or they have freezer meals, or someone says, I'll do your child care or your laundry or your cleaning, do it. Okay, you've got enough to worry about just getting through, particularly the first few months, the day-to-day activities. A lot of the supermarkets nowadays will do online ordering and deliver to your house. Yeah, I know it's a $20 or a $30 fee to do it, but if you can afford to do that, to offload and give you those few hours, then by all means do it. I know, I'm coming.
Quick, because the food, if you hang around too long, the food will all be gone.
And then Diane's gonna have to go out and bring us all back food.
A pizza, it's a great thing. So offload whatever you can. If you need help with childcare, picking things up, babysitting, homework, do it. I'll be really quick. So the one thing that I want to leave you with is to celebrate life and stay positive. Be your own advocate. You are absolutely the exception. Okay? Someone has to be the exception, so make it you. Enjoy the good days and the good moments. Make sure you have a sense of humor. And do the things you love. Okay? I'm going to point out Flo. Flo is skydiving. She is our cover girl.
That's it. Is that really?
Okay, that's Flo.
That is so cool.
That was her dream. She always wanted to do that.
I saw them online. Stan sent pictures.
Yeah.
I saw it. That was fantastic.
Okay, the lower picture is Jenny McDevitt running one of her marathons.
Wow.
Okay, GBM, 7-year survivor. She ran 7 or 8 marathons and numerous half. The gentleman on the top right is Joel Kreitzer. He was diagnosed at 14, maybe 13. He was in 8th grade and loved football, was playing football, and that was really where he wanted to go with his career, to be a professional football player. Diagnosed with a brain tumor, had surgery, and never was able to play football. Ended up running track, and his senior year, his relay team came in first for state champion. So junior year, they were 6th. Senior year, he was first. They were on the podium, which was great. And David, who runs marathons, and yeah. And the other thing, I had another picture up here of David, and that was with him doing karate. He asked me to swap it out. But if there's something that you've always wanted to do and you enjoy doing, do it.
I'll pass it on to my sister, but I like to eat, so I'll go.
Go ahead. So the one thing that I want to leave you with, and this is from Jimmy Fong, is that whether you have 50 years, 5 years, 5 days, 5 hours, or 5 minutes, live your best life now. And he always felt that attitude determines the altitude in your life. So have great expectations, dream big, be the exception, believe in yourself.